April 27, 1955. A single syringe shattered the promise of a disease-free America. In the weeks that followed, a faulty polio vaccine administered by Qatar Laboratories infected an estimated 40,000 children, left 200 permanently paralyzed, and claimed the lives of 10 innocent youngsters. The Qatar incident became a stark reminder that even miracles can turn lethal when oversight fails, and it reshaped vaccine regulation forever. Polio, known then as infantile paralysis, had haunted the United States for decades. Every summer, headlines warned of towns crippled by an invisible enemy, and families lived in fear of a disease that could strike without warning, leaving victims with a life in a wheelchair. By the early 1950s, the death toll hovered near 3,000 annually, and the economic burden of caring for survivors strained communities across the nation. The desperation for a cure was palpable, and the scientific community rallied around Dr. Jonas Salk, whose inactivated poliovirus vaccine, IPV, showed unprecedented promise in early trials. In 1954, the Salk vaccine entered a massive field trial, the largest medical experiment ever conducted at that time. More than 1 million schoolchildren across the United States received the vaccine, and the results were staggering: a 90% reduction in polio incidence among those inoculated. The triumph was hailed as a turning point, and the U.S. Public Health Service, PHS, moved quickly to license the vaccine for widespread use. To meet the burgeoning demand, the government turned to private manufacturers, among them Qatar Laboratories, a Chicago-based company with a long history of producing biologics. Qatar's role was pivotal. The company received the vaccine formula from the National Institutes of Health and was tasked with scaling up production to fill the nation's urgent need. In early 1955, Qatar shipped its first batches of the vaccine to public health departments. The product was labeled inactivated, meaning the poliovirus had been killed by formaldehyde, rendering it harmless while still provoking an immune response. Yet, beneath the sterile glass vials, a critical flaw was taking shape. The root of the disaster lay in the virus inactivation step. Formaldehyde must be precisely measured, the mixture maintained at a strict temperature, and the exposure time carefully monitored. Any deviation could leave live virus particles intact. In Qatar's facility, a combination of rushed timelines, inadequate equipment calibration, and a misinterpretation of the inactivation protocol resulted in insufficient exposure. The virus was not fully killed. The first signs of trouble emerged in late March. A handful of children in St. Louis, Missouri, began exhibiting classic polio symptoms: fever, muscle weakness, and rapid progression to paralysis, just weeks after receiving the Qatar vaccine. Physicians, still convinced of the vaccine's safety, initially dismissed the cases as coincidental. But as reports poured in from other states, Kansas, Illinois, Texas, the pattern became undeniable. By early April, the PHS had identified a cluster of vaccine-related polio cases tied directly to Qatar's lot numbers. On April 27, the PHS issued an emergency recall, pulling the suspect vials from clinics nationwide. The announcement sent shockwaves through the nation. Parents who had trusted the vaccine's promise now faced the terrifying reality that their children had been inoculated with a dangerous pathogen. The media dubbed the event the Qatar crisis, and public confidence in the new vaccine plummeted. In the days that followed, investigators raced to quantify the disaster. The numbers that emerged were chilling. Roughly 40,000 children had received the contaminated vaccine. About 200 of them developed irreversible paralysis, and 10 succumbed to the disease. The tragedy sparked an immediate congressional inquiry, leading to the formation of the Senate Special Committee on Poliomyelitis Vaccine Safety. The hearings, broadcast live, featured anguished parents, frustrated physicians, and government officials scrambling for answers. The trial of Qatar Laboratories began in the summer of 1955. Prosecutors argued that the company had acted with gross negligence in violating established safety protocols, while the defense claimed that the unprecedented scale of production and ambiguous guidelines contributed to the mishap. Expert testimony revealed that Qatar had skipped critical quality control steps, failed to perform the required virus inactivation test on each batch, and ignored internal warnings about temperature fluctuations during the formaldehyde treatment. The courtroom became a theater of scientific accountability, with the nation's health hanging in the balance. Parallel to the legal proceedings, pathologists performed autopsies on the children who had died. The findings were harrowing. In each case, the poliovirus was discovered in the anterior horn cells of the spinal cord, identical in strain to the one used in the Salk vaccine. Microscopic examination showed that the virus had retained its ability to replicate, confirming that the inactivation process had been incomplete. The autopsies provided the definitive link between the vaccine and the disease, sealing Qatar's culpability. The aftermath of the Qatar incident reshaped the entire landscape of vaccine development and regulation. The PHS instituted a series of stringent reforms known collectively as the Qatar Standards. These included mandatory, batch-by-batch testing for residual live virus, standardized temperature controls, and independent oversight by the newly created Division of Biologics Control. The Food and Drug Administration (FDA) was granted expanded authority to enforce good manufacturing practices (GMP) across all biologic producers. Moreover, the incident spurred the establishment of the National Vaccine Injury Compensation Program decades later, a system designed to provide relief to individuals harmed by vaccines while shielding manufacturers from crippling lawsuits. Public trust, though shaken, eventually recovered. Subscribe to the Autopsy Files for more stories like this.